Our next rewarding career opportunity in healthcare is on the front line of defense for a hospital's digital infrastructure. The team from the University of Kansas Health System in Kansas City shares the career options available in health IT and cybersecurity.
Hi, I'm Michael Meese, and I work as the Associate Chief Information Security Officer for the University of Kansas Health System. Just like our doctors and nurses protect our patients' health, my team and I work together to protect all the important computer systems and patient information that our health system uses every day. Our staff monitors our Security Operations Center 24/7, 365. We call it the SOC for short. This is like a control room where we keep our hospital's computer systems safe from anyone who shouldn't have access to them.
You want to go ahead and click on that for me real quick.
Our team of cybersecurity specialists are like digital detectives. We look for any unusual activity in our hospital's computer systems that might mean someone is trying to access information that they shouldn't. One of the most interesting parts of our job is using special computer programs that help us spot potential security problems. Think of it like having a high-tech alarm system that watches over all of our hospital's computer and medical devices. We also spend time talking with our doctors, nurses, and a variety of other hospital staff. We help them understand how to keep patient information safe when they're using computers and medical devices. This might mean teaching them about strong passwords, or how to spot fake emails, or what to do if they download a computer virus. Most of our job is like a puzzle solver.
Go ahead and show me the link that you clicked on.
Yeah, so it's this one that I got a couple days ago.
Okay.
When we find a security problem, we need to figure out the best way to fix it quickly so that our health system can keep taking care of patients without interruption. If you're interested in becoming a healthcare cybersecurity specialist, you'll want to start by learning about computers and networks, as well as how to protect them. Many of us started by studying computer science or information technology in college. There are also a variety of special training programs and certificates specific to cybersecurity that you can also earn. The best part about our job is knowing that we're helping protect our patients' private information while making sure our hospital's important computer systems stay safe and work properly. Every day brings new challenges, and we're always learning something new. If you enjoy puzzles, working with computers, and want to help protect people, a career in healthcare cybersecurity might be perfect for you. You'll also get to use cutting-edge technology while making a real difference in people's lives.
Let's hear from our panel about the career opportunities working in health IT and cybersecurity. Joining us this morning from the University of Kansas Health System in Kansas City is Matt Gage, Eric Guillen, excuse me, Eric, and Jennifer Blackburn. Good
Morning.
morning.
Good morning.
All right. Well, can each of you tell us about what you specifically do in your career and what education and experience you received before your career in health IT or cybersecurity? Eric Ian, let's start with you.
Yeah, absolutely. Thank you, Cindy. So, right now at the health system, I lead our incident response team, which essentially is a team of members, both engineers and analysts, who monitor alerts within the network, looking for any bad guys that might be trying to attack us. This is something like monitoring our firewalls or looking at detections that might happen on the computer, or even phishing emails that might also come in through the network as well. But prior to that, I was actually doing something called offensive security or ethical hacking. So for 10 years prior, I was the one trying to break into the company or test the website to make sure that anything that is presented out to the internet or to customers, that a bad guy couldn't also break into that as well. So that was a very fun and exciting time. Now going more towards the defensive side is where I'm at. But my career path really did start in school where I got my degree in information security. Took a lot of certifications as well to teach me all the different things needed to perform my job.
All right, let's hear from Jennifer. Jennifer, what about you? Tell us what you specifically do
Yeah,
and your background.
yeah, so I'm part of our governance, risk, and compliance team in our cybersecurity division. And so our team is looking at all the different risks that are threatening the health system. And then we're able to quantify those. We're able to put numbers to what it would cost if a ransomware attack happened or a data breach happened. We're looking at the security of our third parties, the medical devices that are connected to the health system and the policies that go along with it as well. And so, being in GRC, I had a slightly different career path than probably most people in cybersecurity. And my degree actually was workforce development. But I got into compliance right outside of college, and then over the course of 13 so years, compliance really evolved into what we now consider governance, risk, and compliance. And so when I joined the health system, their GRC team was up underneath cybersecurity. So I did get some additional cybersecurity and security credentials to kind of bring me up to speed in some of those different areas. How about you, Matt?
Thank you, Jennifer. So at the health system, I am over the security architecture and engineering, one of the teams inside of there. And our main focus is looking at the overarching infrastructure for the health system. We spend most of our time trying to see the big picture of how attackers could reach in and get to our network and try and build the security from the ground up instead of once they've breached the system where Eric's team really takes over, we're trying to stop them from the outside from even getting in. A lot of the work that we're really doing is building on the tools that you hear about constantly, from firewalls to email security. We're really working with the teams that are using those daily to make sure that they have all of the information they need to perform incident response and really go after anyone who might be trying to break into our systems. My career started out in high school working with our system administrator. He had reached out during summer school and was looking for anyone who wanted to learn about computers. And at that point, I was really wanting to learn more about them. And so I started working with him and gradually worked into a 2 year degree at a college in IT security, and then grew from there through system administration and networking, really filling out kind of what security looks at. And I think one of the things that helps security the most in growing is the idea that you can see computers from every side. It's not just a one faceted piece. Security covers so many dynamics. And so growing through certifications and college really brings that out to be able to perform our jobs.
Those are great. I appreciate all that. I wanted to ask each of you, and we'll start with Eric again. What would you say is the most critical cybersecurity task that you're currently working on, or maybe it's a threat that you're helping to prevent? If you picked one, Eric, what would that be?
Yeah, right now, a lot of it is through email. So a lot of the attackers are trying to send phishing emails, which is what we call it. Essentially, it's a fake email or an email that has a link in it that someone needs to click. And they're just trying to entice our employees to give up something such as their username and password or even to install software on their computer. So it's something that we are constantly making note of, trying to analyze the different techniques that they're using and really focusing on that because email is kind of that gateway into a company. A lot of communication is done via email, and the bad guys know that people get so many every single day that an employee can be a little lazy at times and may accidentally do something by mistake. So that's one of our critical things that we do.
And
What
Jennifer?
about you, Jennifer? Yeah.
Yeah, mine would be vulnerability management right now. And so, from my perspective, we're going through and looking at all the different vulnerabilities within our system, and I'm prioritizing them and sending them out to the different support teams. So that way we can make sure that there's the appropriate mitigations and remediations in place, and working with those vendors as well, especially our medical device vendors, on making sure that their medical devices are as up to date as possible to help kind of prevent some of those entrances into the health system as well. Matt?
Yeah, so mine right now is building a security reference architecture. And what that means as our health system grows and we work with other organizations, we want to ensure that as their data is getting to us and as we are integrating with them, that they have a security posture that matches our health system currently. So we're working to build a roadmap for those organizations to reach the security posture that UKHS already has and is maintaining.
All right. Well, now I want to get to what you love about what you love about the job. Like, what is the most rewarding part of your job in either health IT or cybersecurity? So let's go, Eric.
Yeah, I love the evolution and the changes and how something that we see today could be different tomorrow. I mean, these bad guys are always trying to circumvent all the different controls we have, right? Everything that we try to block, they try to find a way to bypass that. So I love how my job every single day is looking for that anomaly or that thing that could be different previously and really trying to prevent the bad guy from getting in the network.
And then for
Jennifer?
me, mine was actually a specific incident that was the most rewarding. Some of you may remember over the summer hearing or maybe seeing the CrowdStrike incident, all the blue screens that hit everywhere. And so, being part of the GRC team, we aren't normally the ones that get to deal with the incidents. We're normally more behind the scenes. And so, I found it really exciting to get to go on site. We were on site for it was like the entire weekend, round the clock. And we got to go into every single part of the hospital, whether people were, you know, middle of operations or we're going into the gross path labs, just parts of the hospital I didn't even know existed, and getting to be hands on and actually seeing and making a difference with the doctors and the nurses and the patients. And I mean, it was very rewarding getting to be hands on with that. I know it was a very stressful time for a lot of people, but since I don't have to deal with it often, it was very rewarding and exciting.
What about you, Matt?
I would have to say my most rewarding is when I got the understanding of how many lives we affected in the health system. I came from the private sector, and while I appreciate the work that I was doing there, working with companies, when I got into healthcare cybersecurity, I got to understand how many people we were protecting and all of the data that we were ensuring the bad guys couldn't get to. And then when you find out the value of those things, that when it hits the black web, dark markets out there, you really realize the work that you're doing and how much it matters. And I think that was the most rewarding thing for me, was really getting that understanding that cybersecurity in a healthcare field matters and it's very needed.
Couldn't have said it better. Jaren, I'm sure there are a lot of questions in the chat. So I'm going to turn it back to you to kind of navigate what our chat feature's saying. Jaren?
Yes, we're going to get through as many of these as we can. And of course, want to remind folks that are watching, we'll send follow up emails for those questions we might not get to today. But maybe the first one is somewhat of a flash question. If somebody graduates with a health information technology or health information management degree, or rather similar, maybe billing and coding based certification or credential, does that make them a good fit for more of this health IT cybersecurity side? Or is that maybe more specific to other departments in the hospital? Or what would you recommend? And I'll leave it up to the three of you if anyone has particular insights that might want to lean in on that.
Yeah, I'll take a stab first, Jaren. Absolutely. I would say anything that's healthcare related will certainly help within a cybersecurity or even just an IT role within a health system. One of the biggest things that at least my team looks at is having that curiosity and the ability to continuously learn. A lot of times when we hire people on, it doesn't necessarily mean they have to be experts in the field already. We can teach that, but having that ability to say, you know what, I don't know that, but I'm going to go learn it is very important. So if you do have, say, a health IT or management background, that can only help you.
Well, we'll keep bouncing it around. Maybe Jennifer or Matt on this next one, if you have insights. Are there any openings for newcomers currently preparing for the Security Plus? I'll probably butcher this. The CISA Plus or CCNA. Does that ring any bells for either of you, or we'll toss it back to Eric potentially if needed?
Yeah, I'll take that one. There's definitely entry positions. So in cybersecurity, we have multiple levels of knowledge, and people coming with a Security Plus, that is a very large entry level certification. And I don't take that lightly when I say entry. When you get into taking the time to pass that certification before you're looking for a job, showing the organizations that you're applying to that you've already put some extra time into learning and growing in your field is always going to be a leg up as you go to apply.
Thanks, Matt. Another question. What coding languages are most frequently used, or does it maybe depend on the hospital?
Yeah, I'll go ahead and take that one. It all depends, right? I think there's so many different languages out there. I would certainly say maybe for Microsoft, PowerShell is a really good scripting language to learn. Python is another scripting language that is frequently used for, doing day-to-day tasks. Overall, it all depends if you want to be a developer, someone that actually is hands-on code. Then I would recommend a language such as C, C++, or even Java. But as far as being able to do your job as a cybersecurity professional, being able to at least understand the concepts and learning how to read the code is enough, because a lot of times the malware, right, that malicious software that may get into your environment, if you can read and understand what it's doing, it helps you defend it even better.
Well, and we have time, I think, for one last question. And it sounds like this one, Eric, you might be able to take best. Someone that is asking, what is working in ethical hacking like, and how do you learn to become an ethical hacker?
Yeah, I mean, this was something that I'm very passionate about. So I'd say so. Ethical hacking is essentially pretending to be a bad guy, but doing it for good. So the first step is really to make sure that you're authorized to test whatever it is that you're testing against. You can't just go to your church's website and start hacking it without their approval, right? So having that first is important. It really comes down to curiosity. A lot of times you're going to encounter something that you've never seen, or has a back end on the website or the network that is foreign to you. Well, it really comes down to try to learn on the fly, being able to get your Google searches on right, being able to read manuals and really understand what it is you're trying to attack. That way you can, have that, knowledge of how it works. To get into it though, there are certifications out there. We can certainly discuss it later on if you want to reach out directly. But there's a lot of great training resources out there that teach you the techniques that the bad guys are actively using.